Should I make some dal? Should I make some aloo gobi? So the oil is burning. So this is a problem. When you burn the oil, we have a problem. The oil is not the problem. You are the problem. You can drink coconut oil. Nothing will happen to you. But when you burn oil, if there are engineers or, what do you call it? The biochemistry people here, they know that if you burn the oil, it becomes oxidized. The oxidized oil is very bad for the blood vessels, very bad for the heart. So if you don't actually burn the oil, it's okay. It destroys the arteries. Next one, please. Now, people ask me this question: can stress cause heart attack? Because we doctors also sometimes we are like priests. We are like priests, priests in the temple. Somebody is smoking. Hey, don't smoke. Somebody is drinking. Don't drink. Somebody is doing something. Don't do that. It's not good for you. Because we are actually very pessimistic people. We want to prevent everybody from enjoying whatever they do. So, do you have stress? Don't stress yourself. Okay. Can stress cause heart attack? There is scientific evidence. Next one, please. It increases the blood pressure. It increases your hormones like adrenaline and cortisol, which is not good for the heart. Next one, please. An indirect effect. If you have stress, okay, if you're a smoker, you will start smoking more. If you're a drinker, your drinking will be more. Next one. And also, it is documented in scientific terms that it reduces the good cholesterol and also it makes the blood clot more easily. Stress is required in the war field. One of the reasons why we are given stress in the war field is because if you're stressed, your bleeding will stop immediately, and because the blood will clot. But every day if you go to war, there is a problem. Next one, please. Now, in all countries adopting a Western lifestyle, the stress has increased. So that's why the heart disease has gone up. And heart attack is alarmingly on the increase in these particular countries where we are adopting a Western lifestyle. Next one, please. Except in Japan. Heart disease is one of the lowest in the world in Japan. The reason is, next one, please. But this is not true for all Japanese. The Japanese who go to Japan, especially who have migrated to America, in I think post-World War II, there was a large number of Americans who have gone to the western part of America. Their heart attacks is very high. Next one. Why Japan is spared? Because in Japan they still keep a traditional diet, a traditional family structure. Next one. With the traditional diet, the fat level in the diet is low. It reduces the cholesterol and also it reduces the oxidized cholesterol. Next one. Traditional family structure, it reduces the stress. It increases sense of security. Now, many of our homes only husband and wife. So if you start fighting, the fighting will go on until one drops dead. In the previous generation, if you start fighting, the father will come and say, hey, why you are fighting with your wife? Come and sit here, okay? Or they will intervene. There will be some kind of what is called lubrication or shock absorber. That's what I was looking for. So here, there is a problem with the family structure also. Next one, please. So all these good qualities of diet and family structure, they are lost on migration. That is why the migrants are more. Because you're alone here, your diet is different, McDonald's, takeaways. Next one, please. But as I said, the Japanese and American have high rates of heart attack. Why I am saying this, you have to understand what I am talking about. Okay, why this happens so. Next one, please. So, is migration good or bad? Next one. If you adopt a Western lifestyle, I have crossed over the Western lifestyle. You know why? There is nothing like a Western lifestyle. The Westerners are having a good life now. They exercise. They eat good food. They eat fruits. They eat vegetables. They eat less fatty food. Their heart attacks are less. So that's why I've crossed over the Western. There is what's called, if you adopt a modern Indian life, you have a problem. Our idli, there is no fat in it. Our sambar, very good. You can drink it from morning till evening, nothing will happen to you. Next one, please. So living and working and adhering to a traditional culture, good. Next one. But we already have a problem where our genes are not good. Then you are actually putting a lifestyle which is an environmental trigger, stress, and added with migration. It's an ideal combination for heart attack. Your Excellency, if you're looking for a cause, just look at this slide. We have a problem. And this is what we have to address. Next one, please. So we know there is a problem. We know coronary artery disease is increasing. We know the factors that cause it. Next one. We have medicines. We have excellent technology. We have very good surgeons in case somebody needs a bypass operation, no problem. Next one. But question is, why don't you treat them all? The problem is available treatments are not a cure. Unless you modify your lifestyle, unless you modify the risk factors which are responsible for the problem, you are not going to escape. Next one. So those without heart problem need to take precautions to avoid it. Next one. Those who already have heart disease, they should modify the lifestyle. Along with the medical treatment, they have to modify the lifestyle. Next one. Next slide. Please get started. I think just say wait for the rest. Anyway, modify the lifestyle along with the hello. Anyway, I've almost finished my talk. I think the system is so. There are not the slides. Okay, so what I'm saying is we have a problem. We know the treatment, but just by going to the hospital and getting some treatment is not enough because we have to modify the risk factors, modify our lifestyle, and okay, if you can go to that slide, maybe go down and maybe there are 5 or 6 slides left. That one. Okay, we can go from there. Yeah. I think the modern technology also has a problem like the modern lifestyle. That's what it says. And previously we used to have these simple papers, I show on that thing. It always used to work. And this also is a risk factor for heart attack when you are a speaker. Here it is okay, you are understanding people, but okay, next one please. So modify lifestyle, what modification? I mean, I don't want to repeat what Dr. Vinod says. You have to stop smoking. There is no compromise on that. It damages the heart. Next one. Diet, just to summarize, if you actually say a lot of things, people will not remember. So I always tell them, avoid, reduce, eat more. Next one. Avoid saturated fat, which doesn't make sense to you, I know that. That's why I put fried food and takeaways. Okay? These are 2 things you should avoid. And people always ask me about coconut oil. Coconut oil has no cholesterol at all. It's an American invention to sell that palm oil. No vegetarian product has cholesterol in it. As I said, the only problem with the coconut oil, like any other oil, if you boil it and fry it, then it gets oxidized. If you drink coconut oil every day, nothing will happen. Okay, next one. Now you have to reduce certain things like commercial fried food because that contains, in our terminology, what is called trans fatty acids and polyunsaturated fats. So cookies, commercial fried foods, and some margarines you have to reduce. Next one. To avoid a heart problem, it's not enough that you reduce your intake of certain food. it's important that you take more of these things to reduce the heart attack. Because you need antioxidants, you need HDL, which are protective. And that comes from these fruits and vegetables. Now, especially fruits and vegetables, the colored ones. I think God has a purpose in everything. The more colored the fruit, the more colored the vegetable, the more good it is for you. Because it contains a lot of antioxidants. Now, you have to eat fish, which is very good. Lean meat. Lean meat means without fat. Legumes and whole grains are good. Next one. And be liberal. And we know that nuts, they're very good for you. Especially in the DASH diet, they have shown that. Garlic, which will reduce triglyceride. Okay? And I always say, garlic you can eat, it will reduce your heart attack, but your wife may not always like it. So you have to choose between these. Then you can be liberal with canola and olive oil. Again, don't burn it. I mean, putting in the salad, because olive oil is a rich, there's a rich supply of HDL if you use olive oil. And soya products are good. Okay. Next one. Now exercise. Exercise has very good effect. Reduces the inflammation of the blood vessels. It reduces bad cholesterol. It increases the good cholesterol. Next one. Any type of exercise. Walking, swimming, jogging, anything. Cycling. Okay. Next one. The American Heart Association recommends that if you do 30 minutes a day for most days of the week, that means I would say 5 days of the week. 2 days you don't need to do. If you do 5 days, 30 minutes to 45 minutes, that's enough. Okay? And more importantly, make it part of your daily life. If you want to Marina Mall, don't try to park your car inside the mall, on the shop. Try to park it a little bit away in a car park and walk. And similarly, whenever you can use the stairs, try to do that instead of using the lift. That is what it is meant by make it part of daily life. Next one. Stress, okay. Now, this is known. The problem is not the stress, because we cannot avoid stress. Daily life, daily work, but it's the way you react to it that makes you susceptible. So how you can reduce the impact of stress? Relaxation techniques. Many are available in the market, but thousands and thousands of years our own yogis have told us about yoga, and that's the best technique you can use to reduce stress. And only thing is, it can be achieved only with training. It's not enough that you just do yoga today and expect result tomorrow. No. It has to be a part of your life. I don't mean to say that you have to be yogi. I mean yoga. Exercise. Next one. Coming to my last slide. There are only two tragedies for an Indian. One is getting what he wants, other is not getting what he wants. So you need to learn to enjoy your life with good diet, good exercise, relaxation technique, rather than stressing yourself all day. Okay? Next one. So be kind to your heart and others' heart. Develop a society with a positive attitude. Every day you smile. Okay? That's something we don't do. And smile is very good for you. Next one. Thank you very much. And as our Prime Minister says, start cleaning. Start cleaning not only the streets, but your heart, your blood vessels. Thank you.
Thank you, Dr. Suresh, Dr. Vinod. Now it's time for question and answer, and before that, I'd like Dr. Dhawan also to join the group. Dr. Dhawan is a senior cardiologist at New Hospital. He had done his cases and observations on coronary artery disease in Asians and Caucasians, which was accepted for PhD by Manchester University, UK. In addition to many publications and chapters, he has written chapter on coronary artery disease in Asians and heart disease amongst people from Indian subcontinents. And that's the reason he is here today. And I'll encourage people to ask questions from these three people, whatever.
I was saying don't go to private hospital, but now you can go to private hospital because Dr. Dhawan is. It so happens that we were trained in the same place. I just saw him now. Then
I think I'll take a few minutes of your time. First of all, thank you so much for inviting all of us together, and all of us are dear friend. And His Excellency, I think this is an initiative from your part. I want to take you back in 1980s, in 1989, I joined William Shaw where my colleagues also trained. And at that time, this was a referral center in Manchester where all Asians used to come with heart attack. And there were only 2 papers written at that time of increased incidence of heart disease among Asians. And I was in training at that time in 1989. So imagine at that time, there were no statins, there was hardly any coronary angiography, and there were 50 years old English people coming and 25-year-old Indian shopkeepers coming with heart attack. So that started, we started researching into it. That's how I was brought into today's lecture as well. That, why are we different? Both my colleagues have said so many good things about what has happened so far, but I'll share a couple of important aspects. I did pathology on them as well. That is, I dissected out coronary arteries in English people and in Indians in India. One of the important things is that if you see, our body surface area is small. So the first thing is that coronary arteries are smaller. The average coronary artery of an Englishman is 3 millimeters and an Indian is about 2.5. This is the average. So if you have a smaller artery, it will take less time for it to be deposited with cholesterol. So that's the simple fact. Okay, you can't do much about it because your body surface area will remain the same. Second thing is, on histology, we saw that when an Asian artery is deposited with cholesterol, the inflammatory cells are more. It's an aggressive inflammation around the small bit of cholesterol which deposits in the artery. And in an English artery, it was less. So there's nothing much you can do about it. At that time, when we did that, there were no statins. When statins came and the amount of coronary artery disease started reducing, one of the side effects of statins is that they reduce the inflammation. So now you can take it from there. The other thing which, at that time, there was one paper from Rohtak. Why I'm saying that is because it's an important message. At that time, some professor in Rohtak did ECGs on rural population and ECGs, simple ECGs in urban population in India. In the rural population, there were hardly any incidental heart attacks noticed on simple ECG. And on simple ECG in late 80s, in urban center, there were incidental heart attacks picked up. From there, the correlation is that the more physical work you do, the more near to your origin. We are originated as an agricultural society. We're not originated, this lifestyle or whatever, this pot belly is a new phenomenon. Now tell me one thing, it's an observation in nature. How many 80, 90-year-old Indians you have seen who are fat or who have a pot belly? You will see very few. If you see 90-year-old in India, they will be all slim. So this waist-hip ratio, which my colleague actually alluded to, we found that it's got a very distinct relationship with early death. If your waist-hip ratio is more than 1, you are sure not to reach maybe 80 or 85 years of age. And why that happens is because of insulin, metabolic syndrome. That is insulin resistant. So you can't do much about your coronary artery, they are small. You can't do much about the aggressive inflammation, but you can do. If you want to reach 80, 85 years of age, reduce your abdominal fat. And that is one message I will give you. Reduce your abdominal fat, howsoever you do it. And the enemy of Asians is carbohydrate. If you reduce your carbohydrate, you will reduce your abdominal fat. And lastly, I will say something about what my friend actually had alluded to, that the English people know how to live and they go on holidays. And so the other side of the coin is that most of my colleagues, after 60, very few actually Asians keep at work. But many of the English people are, so why? They have to pay alimony, not only to one divorced wife, but to the second or the third divorced wife. And that is very, very rare in our society. So there is a both sides of the coin. I went to UK in 1983, I've been staying there for about 30 odd years. So I see the good and bad. You see, our society is a very good, shock absorbing society. The stress in the Western society is 2 or 3 times what, imagine you work at 65, you retire at 65 in NHS, you cannot work more than that. Imagine you have to keep planning. My colleagues used to keep planning how much alimony is to be going to this and how much, and they all die as poor people. not, the divorce rate in UK among English is 46%. 46%, and the divorce rate may be more in India at the present time, but I think we have to take the good and the bad from both the societies, and if the one take-home message you should take from today is that if you reduce your abdominal fat, your chances of living to 80-85 is high. Thank you.
Yes, please. Forum is open for question and answers. Yeah, please.
Good evening, everybody. Thank you very much for conducting this awareness. I have one small question. I have a higher triglyceride. Always it is noticed higher. So I am taking lipithiline before, lipithiline tablet. So it was, my muscle was cramping. So I stopped this one. Then I take TG Gold from India. That is for me. I am taking half tablet. So now my TG is under control. So just for me this one here further. So I'm checking this one month and checking each month. Okay. So I'm getting some pain here. It is muscle pain. So can you advise further I can take?
Hey, for your pain, first of all, if you have seen a doctor and if we said it's a muscle pain, you don't have to worry about it. Because the commonest cause of chest pain is not heart attack, it is muscle pain. Okay, so you're okay with that. Now, with regard to a triglyceride, I mean, you have to continue medicine. Now, once you start medicine, there are other methods you can use to supplement that by, as Dr. Dhawan said, reduce your abdominal belly by exercise and eating less fatty food and carbohydrate. So if you continue to do that, after some time your doctor may be, I'm saying maybe, able to stop the medicine and then see whether it is going up again in the absence of medicine. Okay, so it can be done only by trial and error.
When it is in, stop taking, it is.
That's what I'm saying. So you did a trial and the error occurred. So you have to continue your medicine. You have to continue your medicine.
I have to keep on continuing.
Yes.
Thank you.
Next question, please.
My name is Alpesh. I am from Gujarat. Actually, I want to thank all of you for such a nice awareness. Now, I have a heredity of high cholesterol. I do regular exercise. I eat fruits. I take olives. Then whatever the steps you have shown, I am following everything. But I think due to heredity, my HDL doesn't come about 24 to 28. It always remains at 24 to 28, whatever I do. Suppose I do 45-minute exercise, if I go to increase it to 60 minutes, 70 minutes, that ratio remains almost same. This LDL slightly gets reduced, but still it remains same only. So what further can be done? Plus I am taking medicines also as just a precaution, statin. But the big question is whether statins are having any ill effects, as there are a lot of controversies about the statins.
Actually, we can reply this only on the basis of certain studies.
Yeah.
It is not in any individual doctors or individual patient's experience. Yes, agreed. The statins can cause certain muscle cramps and certain liver dysfunctions, but it's not applicable for all patients. But to us, the studies have proven that the statins decreases the LDL cholesterol. The statin stabilizes the plaque. Yeah. There is a cholesterol plaque in the body, in the coronary arteries, and statins adhere that cholesterol plaque onto the vessel wall without rupturing it and preventing the heart disease. In such scenarios, you have to continue on statin if the taking statin only decreases your total cholesterol.
Yeah.
Again, regarding the HDL, the exercise is one strategy which can increase the HDL levels in the body. And there were certain other drugs like nicotinic acid which were claimed to increase the HDL, but it has not been proven convincingly. So, as far as HDL is concerned, I don't think there is particularly any intervention that can increase the HDL in a particular body other than the particular amount of exercise. And there are certain guidelines like alcohol and all, which is not advisable to any of the general public population.
You know,
Thank you.
there is something written about Mediterranean diet. See, people along the Mediterranean, they have less amount of heart attacks. The reason behind that is they eat less of fried foods, they eat more of uncooked olive oil, and they have a glass of wine at lunch and a glass of wine in the evening. Okay, now if you have a moderate amount of alcohol, it helps. And if you exercise 5 times a week, it helps. Apart from that, it is drugs. And Indians by our genes have got a lowish HDL and a highish triglyceride. Our average cholesterol is not very high, but our HDL is genetically a little lower and triglyceride is genetically a little higher. And if you can then, the best thing in life is really a moderate lifestyle. If you have a moderate lifestyle, don't put on too much weight. You're not fanatic about exercise, but you do enough and have a common sense approach. And if you drink alcohol, you are a moderate drinker or a social drinker, and don't smoke, and that's the best you can do. What else can you do? You can't change yourself. And also you have to enjoy life. You're not here to suffer. You have not taken birth to suffer because you're born in India or born wherever. Life is there to enjoy. It's really not a penance. So you have to find a middle way which is suitable to you, which is useful, and within your cultural norms. We have, if you don't drink, that doesn't mean that you can't have enough HDL. You don't put on weight, you eat less. And I think as long as you tread the middle path, you will see that, everything